Hey everyone. Um, Actually, hey Miss Nia, because you the only one that be watching my videos. But this is my week 6 reading slash reflection. To answer my questions first, I gotta answer my questions. Oh, and I have something I'm so excited to say this at the end of the video. This has been on my mind all week ever since that simulation lab. Anyways, we're gonna get there. I'm just so excited. But to answer my question number one, what do you find the best contribution, whatever? I like how the body can be used in ways to communicate. And I actually have a really good example as to why that is so true. When we get into the readings, my notes, I'll explain more of that later. But number two, how does this affect your positionality? I mean, I can say I take this for granted too, but like, I didn't really need an interpreter or like an ASL interpreter. I'm not deaf, so I didn't really need anything like that in order to like communicate my health or just to communicate in general. But I never really thought about it like on the deaf people side, like what do they do? But I know like well, that's blind people. Never mind. But here's my question number three: like, what do you think is a long term thing on the impact on society? I feel like in order to help the deaf community, I feel like a lot of people should learn ASL, should learn American Sign Language. And that's just because, well, especially people going into healthcare, because you can't, I don't expect random bystander to just, oh, you're deaf? Well, let me see, like, I didn't get that. But anyways, notes, this was my favorite video. Understanding hearing loss in a healthcare setting. I like the animations in there. But, and it's known that like poor communication can lead, we already know this can lead to, like misdiagnosis, misunderstanding in like medical direction, and misled to unknown chronic illnesses and all that, whatever. But like for an example, someone who is deaf, it's harder to communicate their health due to using ASL interpreters or just using American Sign Language in general because knowing that every time a doctor or a nurse has to come see this patient, knowing and this is considered ad hoc if they don't. So knowing that they need to have an American Sign Language interpreter present with them in order to talk about their health or just to speak with them or to just go over daily anything. I said that so wrong because like you can't speak to a deaf person unless you're using American Sign Language. But verbally speaking with them, it's just not going to cut it unless they can read lips. But that's not always the best form of communication. But anyways, and this can cause like a delay with patient care, whereas someone who can like just speak regularly. But effective communication can help reduce the length of hospitals. I'm sorry, can reduce the length of like the amount of stay of the hospital, which is so true. I see that on a day-to-day basis. It can also help with readmissions to the. This proves my point with Dr. Bonsu, and this can like help with like readmissions into the hospital and like unnecessary tests and exams. Because, for an example, if you're just and if you're a deaf person and you're just using American Sign Language, 9 times out of 10, you're just going to say what, like the bare minimum, just to answer the doctor's questions for his needs. Now, had you like not just been saying anything, like the doctor, of course, is just going to order unnecessary exams just to figure out, just so they can just to be sure. However, if you communicate these things thoroughly, you'll have that time. And I get it. It can be frustrating for especially doctors and nurses because every time you have to see this patient, you have to go get that interpreter. And that's and then that interpreter may be on standby or might not be on standby. So it is frustrating. But one thing I don't understand about in this video is the fact that medical personnel should respond to the call light in person. How would you know that that person is deaf? Because when you call a person call light, it ding dings and you answer the phone. Like, how can I help you? Like, I mean, they're going to attempt to speak. You're not going to understand them. But like, even if you are going in person to answer those call lights, do you have to bring that interpreter with you? Because how are you going to go in there? You can't use American Sign. That would be considered ad hoc, right? Also, if you just go in there, 9 times out of 10, I don't even know American Sign Language. Some of these doctors and nurses don't even know American Sign Language. So how are you going to support those deaf people's needs in hospitals if you don't have that specific ASL interpreter on standby? And I feel like if it was up to me, I would definitely have an American Sign Language or any interpreter that works in the hospital in specific departments because it may be times of need and it can delay patient care if they don't have that specific interpreter with them. So that's that. Um, the chapters 1, 3, and 4, deaf rhetoric or something like that. But um, And like chapter one, it didn't really do much. But it didn't really say much. But talk about how like, and I don't understand this. How staying silent is a strategic, like mode of communication. If I ask you a question, you just stay silent. I'm gonna think you ignore me. I'm gonna get irritated, and I'm gonna like just walk off or something. That I might keep reading more chapters about that to see what they actually talking about because I was so much on the blind side of that. Um, and like how visual. Now this also leads into the my answer to my question number one, how like you can use the body to communicate. I'm running up above 6 minutes. Let me hurry up. I do agree that the body and facial gestures can be an instrument of like persuasion. Think about it. For example, charades. You get a word, and you have to act out that word or do whatever you do so for people to understand. And I feel like you can do that too, like with certain forms of communication, but not with all, because some people may just think you just, a little slow. But the moment I've been waiting for, and Miss Nia, like everybody, they just don't agree with me sometimes, and they really just be thinking I just be out here saying the most outlandish things. But I'm gonna just keep it with you straight and real, and not gonna sugarcoat anything. But I did talk to Dr. Bonsu in the simulation lab. I asked him before, and I asked him when everybody got there. I said, Dr. Bonsu, you've seen many patients in your, in your career. Is it true that patients come into the ER or just in the hospital in general and shop around for meds? He was like, yes. He sees it on the day to day. He's seen it on the day, still do on a day to day basis. On how like it was this one patient that came in and it was a reoccurring patient that always gets admitted to the hospital every time they come in and asks for just so many different drugs. And like he literally went through the chart and seen a whole entire list. When I tell you, when he described the list, it was like the we the people kind of list. You know what I'm saying? So he went and seen all the type of drugs they asked for, that they prescribed him from other different doctors too, not just here. But it was very like refreshing and very like okay, like, yeah, because like y'all really thought I was like, they was really getting in my head last week, Miss Nia. That's why I really be quiet sometimes, but I'm still gonna say my opinion. But thanks for listening. Appreciate it.